Everyone, I'm Chris Scott with Fit Recovery. In this video, I want to talk about the link between inflammation and alcohol addiction, more specifically, the risk of alcohol relapse. Recently, a few studies came out that really piqued my interest because they point to inflammation as a common denominator for alcohol relapse risk. And if that is indeed the case, then mainstream recovery programs that view alcohol addiction as primarily a spiritual disease are missing something very important here. So I'll go over these two studies and then I'll kind of bring it back to basics and talk about what is inflammation and why is it significant and some things that you can do to reduce it, especially if you've quit drinking recently. So these studies were done with alcoholic rats. There are certain rats that have been bred to drink like alcoholics, which in itself is interesting. I have an article on the genetic factors that play a role in alcohol addiction on Fit Recovery. But anyway, these rats, some of them were in the first study given an injection of human stem cells that are known to have powerful anti-inflammatory effects. After one injection, these alcoholic rats voluntarily reduced their drinking, which was the equivalent of, for a human, a bottle of vodka per day, by 80 to 90%. And this reduction in drinking lasted for a full month. So it had extended effects. Obviously, the inflammation came back. The only effect that the stem cells had was to reduce biomarkers of inflammation. So that was the first study. In the second study, similar alcoholic rats were given a 1-week treatment with Cbd oil or gel capsules. And CBD is a compound found in marijuana and in hemp, and it's known to be a very powerful anti-inflammatory. And so these rats ended up reducing their drinking significantly for 5 months, and they had much better impulse control. It's very common for humans and also apparently rats with alcohol addiction to have serious impulsivity problems and make bad decisions, or at least be unable to defer satisfaction to the future. And these rats had much better behavioral health markers than they did before consuming the CBD. And so these two studies are really pointing to inflammation as something that should be reduced after you quit drinking. And it's something that I've alluded to, at least implicitly, on Fit Recovery. There are a number of supplements that can help reduce inflammation. Polyphenol-rich herbs like ashwagandha. Magnesium is a very powerful anti-inflammatory. There's actually a study showing that magnesium is as effective as SSRIs for some people because it does lower inflammation. And so EPA, which is a compound found in fish oil, is a very powerful anti-inflammatory compound, especially for reducing inflammation in the brain and promoting brain health. So there are a number of things that you can do that don't involve going and getting a stem cell injection, which I don't think is available or legal yet in most places, or that don't even involve consuming CBD. And with that said, I have tried some brands of CBD oil, and I do recommend a certain brand on my website and in my online course. But the bigger picture here is that if we want to decrease the risk of relapse, then we should be reducing levels of chronic systemic inflammation. So not the type of inflammation that you have if you have an infection or an injury, but that invisible inflammation that comes from having an unhealthy lifestyle, unhealthy diet, and obviously chronic alcohol consumption. Alcohol in particular causes inflammation. One of its toxic byproducts is called acetaldehyde, which is known to impair gut health. It can cause increased levels of these cytokines in the bloodstream, which eventually do reach the brain. And a few years ago, researchers didn't know that these pro-inflammatory cytokines and other compounds could reach the brain, but they do. They cross the blood-brain barrier and they can inhibit the production of dopamine, serotonin, norepinephrine, and other neurotransmitters. So in my view, while it is absolutely helpful to take amino acid precursors for neurotransmitters after you quit drinking, that's going to help you feel better. It's also, you're going to increase the efficiency of all of your supplementation if you eat a diet rich in whole foods, and if you exercise and get enough sleep, maybe try meditation, things like hot yoga, or even using the sauna, jumping in a cold pool. All of these things have been found to reduce the levels of pro-inflammatory compounds in our bodies. And researchers have actually known for years that, or at least several years now, that there is a causal link between inflammation and depression, clinical depression. So recently there was a study that showed, and I have links to these studies in my article. I don't want this to be too long of a video, but there was a study that showed that people with clinical depression who were given anti-inflammatory drugs actually had a profound decrease or reduction of their depressive symptoms. The only thing these drugs did was decrease these pro-inflammatory compounds in their bloodstream, and presumably decrease those compounds' ability to get into their brains and inhibit their neurotransmission. There's another study showing that people who ate whole foods for 3 months who were clinically depressed had more of a reduction in their depressive symptoms than people who went to a social support group for the same amount of time. That was the only switch they made, no drugs, just not eating crap that's processed. And there was another study showing that people who use magnesium instead of an SSRI had similar results. I think I alluded to that before. So all of this research is cropping up, showing that there is a link, not just a link between inflammation and and mental health, what we used to call mental health issues, but that there is probably a causal link between brain inflammation and our behavior, our state of mind, and our mood. So, as I said, you don't have to go find the best CBD oil or get stem cell injections if you want to reduce inflammation. I hope that at some point there is a stem cell treatment for alcohol addiction that would do that. I mean, it would be nice to have a human study that mirrors the rat study, and it would be nice to have a treatment like that does reduce drinking by 80 to 90%. We'll have to see if that can be replicated in humans. As far as CBD oil goes, that is I think a fantastic supplement. You can get non-THC versions. That's what the rats were given. They weren't getting high on marijuana. They were consuming those compounds that are known to have health benefits that are found in marijuana and in hemp. And so I can't recall the brand that I tried. I used a brand of CBD oil for about a week a few months ago, and I found that it helped me sleep. And I knew that it was supposed to reduce inflammation, but I mean, I've been off alcohol for years. I'm not at a risk for relapse at this point. And I mean, alcohol is about as appealing to me as paint thinner. So I really think this is helpful, though, this kind of big picture understanding of the role of inflammation in relapse, or the potential role at least, for people who have recently quit drinking. And I think it imbues lifestyle changes, diet changes, and supplementation with anti-inflammatory supplements with a new significance. So that's about it for this video. If you enjoyed it, please give me a thumbs up, and stay posted for more. Thanks.